Hello, I'm Dr. Joseph from Mumbai. Today is November 14th, recognized the world over as World Diabetes Day. As a responsible doctor who cares for patients with diabetes, it is important that I raise awareness about the disease and also demystify some of the myths that surround the disease. Now, I want to clarify something about this reversal term here. Reversal means, let's say someone is pre-diabetic, which means HbA1c between 5.5 and 6.5. You have already lost some of your beta cells that produce insulin. So the main problem for those who are not aware is that beta cells secrete insulin, and in diabetes, you progressively start losing beta cell function. Beta cells die. Reversal essentially means that these beta cells can be revived somehow, or existing beta cells can multiply and populate and make up for the loss of the beta cells. So you can achieve diabetes remission. You can achieve diabetes remission, which means you can bring your diabetes under control. So today, the number one trending topic in diabetes is that diabetologists are all together in a conspiracy against patients. So once patients are diagnosed with diabetes, diabetologists then put them on lifelong medications. They start with metformin, slowly increase the dose, then add sulfonylureas, followed up by other drugs called gliptins, and they will never take any effort to reverse the diabetes because that can hurt their business, that can hurt their profession. That nothing is further from the truth. All diabetologists that I know uh, have been advising their patients against consuming excess calories, uh, consuming foods that have a low glycemic index, exercising regularly. But all this advice falls on deaf ears. So when a self-styled guru comes online and says things, people fall for that. This advice that you get from your doctors is rather cheap, 500 rupees with a diet plan, all ready made for you to follow, but you wouldn't. And when someone says, okay, it's a gadget that is going to tell you whether rice can cause your sugar to spike or chapati can cause your sugar to spike, and you think, oh, it's this gadget is going to tell me whether rice and don't you know that that information is already well known? So if you have a mixed diet which is enough vegetables, enough protein, enough, and just enough. You need carbs. You need carbs because if you don't take carbs, then your body is going to break down muscles for producing glucose. That leads to a low BMR. Okay, so you don't want that. Sarcopenia or low muscle mass is again a problem, especially in diabetics. So the advice here is consume your carbs. And how much carbs will you consume? Well, this is a 2-inch vati, 2-inch in height, 2-inch in diameter. Roughly, it holds around 130 grams of cooked weight of rice, which corresponds to 30 grams of dry weight of rice. On a plate, it will look something like this. Okay, so if it's level vati on a plate, it will look something like this. You need at least 3 servings of this. So 30 grams of dry weight, 30 grams dry weight rice corresponds to approximately 100 calories. You need at least 300 calories of carbs coming from rice. You have all your other vegetables to meet the other requirements that you have of complex carbs, but you need some simple carbs as well. You can't have spinach, beans, and broccoli whole day. Yes, your sugars will drop if you, but that's not safe. Then the other um, point I would like to raise is regarding with regards to intermittent fasting. Who can do it safely? Someone who is 35 to 40 and is metabolically inactive or physically inactive and metabolically not right, he still has time on his hand. He can try out things like intermittent fasting. But a diabetic, our biggest worry is hypoglycemia at night. We are calling it an MI equivalent. And if people, there are a lot of people who have sugars as low as 45, 50 at night and they don't realize it. Anything can happen. And these self-styled gurus will not take the responsibility for it. All the blame will come on the treating doctor. So that's my short message. Keep it safe. At least consume 3 vatis of rice. You can safely have 5 times a day 1200 to 1500 calories of food, total calories of food spread across 2 to 5 meals a day, which means 3 meals and two mid-morning snack and an evening snack, 5 meals a day. And if you sustain this, which is sustainable. So if you do intermittent fasting, you can't. It's not sustainable. You'll be irritable for a major part of the day, right? So this is something that is practical, can be followed, and be safe. You can go into diabetes remission, not reversal. You can't reverse diabetes. You can bring down your medicines. Those who are pre-diabetic can come, they can bring their HbA1c to around 5.7, 5.8, as long as they live, they follow a controlled lifestyle. Once you're out of control, your beta cell reserves are already less and you will go back to your previous state. That's the short message. You don't need a gadget to tell you all this. Plain common sense. And the final message is, be more sophisticated consumers of information. Analyze the information that is coming through. Don't believe anything. If anything sounds too good to be true, it's generally not true. Your doctors are giving you safe advice. If you follow it, you will be able to bring down your medications over a period of time. Nothing can happen overnight. Something that has happened due to cumulative imbalances over decades cannot be reversed in a short span of time. It will take 6 months to a year. You can bring down your diabetes medications, you can bring down your blood pressure, and at the crux of it is weight loss, but safe weight loss. Make sure you're losing fat and not muscle, because if you just fast for long periods of time, you can't exercise again. Make sure that you are cardiac safe. See a cardiologist, get the cardiac clearance before you begin exercise. That's it. Thank you.